And I'm kind of thinking about the busyness of things. You were mentioning earlier how we have so much little time. Is there a benefit with concierge medicine at all? I noticed there was a couple doctors in Illinois, because I was doing research, how they're moving away from family practice and they're doing more like a subscription model, which ultimately is going to have more time with patient care. Have you noticed any benefits about that, or are you familiar with that type of medicine?
Yeah, I think it's called direct primary care. I think there's a, where do I start with this? Is there's a way that you can create a system for the affluent and people who can afford it and give them exactly the way you want. But a lot of the problems we have in healthcare system or health insurance system is that it is a large network of cross subsidization, because there are some people who get really, really sick and some people who don't get sick at all. And the healthy people paying insurance is supposed to subsidize the cost of the really sick people, right? At the basis of insurance. And we can go into what's so expensive, everything from pharmaceuticals to like PBMs, so people have heard about it. We don't need to go into that. I'm saying all of that because the direct primary care model that you're talking about, yes, I can take care of people who can afford the subscription model and come to me, but many people can't. And often the people can't are the people who are in communities that need health care the most in a personalized way. So I don't know if I would go towards that personalized model personally, because you could think about like community health centers and all of that who take care of uninsured folks. If they could monetize people that way, I'm sure they would have done it that way, because I think they're always looking for funding too. But it made me think of, I think you're going back, I'm going to approach it different way this time. It's like, how do you make more time with people? And I still want to challenge people's assumption that time is time, because there's a perception of time too. And I think we can change the perception almost always wherever we are right now, while having this conversation about how do we ultimately change the time itself without getting too meta here. I'm going to give you an example. I use this example a lot because it resonates with people. I take care of the Native Hawaiian people, Native Hawaiian community, as I mentioned. And one thing that came up when I was talking to a community leader from that community was, hey, like, one thing that clinicians do a lot, which is really frustrating and ultimately leads to a worse encounter, is we show up in the clinic, we show up in the hospital, and they're looking for a way to connect with us, and they talk about their vacation to Hawaii. And I think many people do that. I've probably done that. But then she brought up, like, you're talking about your vacation to Hawaii, but the reason we're here is because Hawaii became unaffordable because of tourism. And that we're now here in this new state, we can't even visit our family because flights are so expensive and that place is so expensive. And now here you are just talking about your vacation, and that's how we're starting this encounter. So one, it points to understanding the historical and structural context of a community to understand that this could be a problem. Not saying I never bring up my vacation to Hawaii to anybody, but now I can ask them before bringing it up, like, hey, like, have you been back home recently? And what is your connection to your home? And they could say, go there all the time, or they could say this, right? I haven't been home in many years because it's been hard. And then two, because if you start out with a negative interaction like that, and that person has to be vulnerable with you of all the things that are bothering with them, oftentimes they're not going to share everything, or they're not going to listen to you because you clearly don't understand. So then they're going to come back with the same problem, or it's going to take longer to save this longer time to like cure or care from the same problem than it would be if they trusted you from the beginning. So part of this is actively not doing things that are harmful, and then that perception of time can change because you can get to solutions quicker when that trust is there between the person and you, right?
Mm.